Hi everyone, I'm Dr. Suneel Dhand, and in this video I'm going to talk about a phrase that I use at the end of phone conversations with patients' family members. We'll take good care of mom. This may sound like a really simple phrase, and let's use the example of mom, but it could be any family member. We'll take good care of mom. Why is a phrase like this so important? Well, let's take a step back for a moment. The current pandemic has changed a lot of things in healthcare, but one of the biggest changes to hospital policy is the fact that patients' families and friends can no longer come in and visit them. And the ritual of being by the side of a loved one when they're sick is probably one of the most ancient rituals out there. It goes back to caveman days, and now all of a sudden it can't happen, and it's difficult for both patients and family members alike. And as doctors, we are of course super busy, and it's easy to see every patient as just another name on the list who we have to try to get better and do our job. And sometimes speaking to family members can kind of feel like an additional task when it really shouldn't. It's an intrinsic part of our job to communicate well, not just with the patient, but with their family as well, who are often more worried than they are. And the words that we speak as doctors are really powerful. We tend to forget that as well. But those few minutes that we have to communicate leave a lasting impression. And I did make a video recently about how we should communicate over the phone and how we can show empathy and compassion. But I would highly advise throwing in a statement at the end like, "We'll take good care of mom." This is a great statement, and firstly, hardly any doctor does it, but put yourself in the shoes of that family member. When you hear that statement, how much it means to you that the doctor is very caring and really rooting for their family member to get better. And we can extrapolate that out to any other field, not just medicine, but when we're talking to someone, communicating, and it's in a professional situation, put ourselves in their shoes. What expectations do they have of us? And as doctors, the expectation that any patient or family member has, aside from obviously knowing that our technical skills are solid and we're going to get them better, is just knowing that we care, that we are compassionate and can show empathy with them. And a statement like that is amazing to throw in at the end, and I advise any doctor, nurse, or any healthcare professional to use that at the end of their phone conversations. We'll take good care of mom.